Hey everyone, this is Olushola Alege. I explored 3 different chatbots, namely ChatGPT, Perplexity, and Claude Pro, to respond to questions relating to public health practice and ethics. I asked each tool about topics such as community-based health promotion, equity in digital health, and ethical challenges related to AI use in surveillance and decision-making. What stood out to me right away was that all 3 tools emphasized the potential for AI to promote beneficence, especially through faster data analytics, early disease detection, and more efficient public health planning. On the surface, that sounds really nice and promising and aligns with public health's goal of improving public health outcomes. However, when I pushed the chatbots to address ethical concerns like autonomy, justice, and equity, the responses became more nuanced. ChatGPT, for instance, acknowledged the risk of algorithmic bias, pointing that AI systems are only as good as the data they are trained on. That biased, incomplete data can reinforce existing health inequities for marginalized communities. Perplexity placed a higher emphasis on transparency and accountability, suggesting that public health professionals have the responsibility to act as ethical stewards by questioning how AI-generated conclusions are produced and used. Claude added another important layer by highlighting that respecting autonomy means ensuring communities are informed about how their data is being collected, shared, and applied, and that consent should not be treated as an afterthought. Together, these conversations may be to reflect on how AI can support and complicate public health practice. While these tools can increase efficiency and reach, they're only as good as the data that they're being trained on, and they also force us to confront difficulty with questions about power, data, and ownership, and who truly benefits from technological advancement. Overall, this exercise reminded me that ethical health practice isn't just about avoiding harm. It's about actively promoting fairness, transparency, and trust, especially when technologies are in their infancy. AI tools, such as these chatbots, can be useful for reflection and learning, but they don't replace human judgment or ethical responsibility. As future health practitioners, it's our role to ensure innovation is guided by values such as justice, equity, and respect for communities, not just efficiency. Thank you so much for listening.